In this video, I'm going to show you how to document treatment plan and goals on the initial visit. Treatment plan, you want to make sure that you document if you perform any adjustments, spinal and or extremity adjustments. The key to this is you've got to document the specific segments that were adjusted. So you've already documented them under your objective findings, under the A of part, so we can bring them over from there to the treatment plan very easily and automatically. Passive modalities, things like electrical stim, ultrasound, and so on, that can be documented. Therapeutic procedures, things like manual therapy, therapeutic exercises, therapeutic activities, things like that. We need to make sure that we document the 4 keys to each code. What was done, to what part of the body or where was it done, for what reasons was it done, and for how long was it done. Also, if you do recommend any home care or send the patient home with anything, you want to make sure you document that also. For treatment goals, you want to make sure that you've got measurable goals that are specific for each condition. In other words, it's not good enough anymore to say generically, if you're treating the patient for headaches, neck pain, and lower back pain, you can't just say goals are to reduce pain, improve range of motion, reduce muscle spasm. Now we've got to have measurable goals for the headaches, measurable goals for the neck pain, measurable goals for lower back pain. You also want to document on the visit frequency and duration. You want to document that at the first visit and at each reassessment. The treatment goals, by the way, Medicare actually wants to see the treatment goals on every visit. So I set up in the program so that your treatment goals, once you enter them on the first visit, they will automatically calculate for you and appear in each SOAP note for every patient, not just Medicare, on every visit. Reevaluation, we are required to document what objective measures we will use to evaluate treatment effectiveness, and we need to be able to document that properly, and we will document when we'll do a reevaluation. So here's how it all looks. So we enter the program, click on the patient's name, click on the appropriate incident. In this case, we're going to resume the visit, so click on the date we're resuming, and then click on resume. If we go back to the part page, you can see that the little eyes are under for specific spinal segments. That shows up in there. Visual assessment and range of motion. We've got something for cervical and for lumbar. And then for tissue and tone changes, daily findings, we've got some muscle spasms. So we already put that in for objective findings. Then when we come over to treatment plan, if you did not do any treatment on the first visit, no treatment at all, you just did an exam, you would click on first visit, no treatment. For contraindications, this does not show up in the SOAP note. This is just for you, for your benefit, if you want to alert yourself to any contraindications. Same goes for alerts. That's just for you to alert yourself to anything. Then we get to treatment plan. Click on treatment plan, and we're going to click on spinal adjustments if you adjusted the spine. Notice how the specific spinal segments that you had documented on the part page automatically appear here, right? As far as adjusting technique, that is optional only, and I actually recommend these days not to maybe document the adjusting technique. In particular, if you're billing in United Healthcare or Aetna, they have a growing list of techniques that they consider to be experimental or investigational. However, I would definitely recommend documenting the technique that you use. If you're using a specific technique for a very specific reason, for example, let's say you want to use a non-force or low-force technique on a patient with osteoporosis, that would be a really good idea to document that. Otherwise, let's just call it optional. For now, we'll skip over that. If we did any extremity adjustments, any of the restrictions that we had documented on the part page would show up automatically as well. Let's say for modalities, we did electrical stim unattended for cervical and lumbar spine. And even though it's not a time code, we still are required to document the time for a different reason. Let's go down to manual therapy. When we click on manual therapy, the muscle spasms that we had already documented on the T of part on the part page already automatically appear for this. And then all we've got to do is click on the number of minutes. Then I want you to give it a name. I want you to label what exactly you did for the manual therapy. So let's say, for example, we did myofascial release and factor. What if we did therapeutic exercise? Click on that, and the visual assessment of range of motion, in which we noted pain, those areas that we documented on the part page automatically appear for this. All we've got to do is document the time. Therapeutic activities is something that's not done by a lot of the chiropractors, but this is a more specific type of rehab that you might do for a patient. So you could be specific in that way, and you document the time. And the other keys to the codes are automatically in the program. If you send the patient home with suggestions or items, you want to document that. So for example, exercises twice a day for the neck and lower back, a hot pack, a cervical collar, lumbosacral support, whatever it is that you send them home with, whether it's instructions or an actual item, make sure you document that. Response to treatment is required in the state of Oregon, but I think it's a good idea for all of us to document that. I have the program defaulting to responded well to treatment. If they did not and something happened, you want to click on adverse reaction, and you would just type in what happened and what you recommended. Plan change and technique modification, that's for the computerized radiographic mensuration analysis. Most of you don't do that, but if you did, that can be something to document. Author of record, provider of service, you do not need to click on those at all. That will simply automatically bring in your name. All right, beneath that are letters. Those are grayed out for now, and then in a soon-to-be update, we're going to be having the ability to send a brief note to your patient's primary care doctor or an attorney. Then we go to treatment plan and goals, and once we click on that tab, the goals are automatically calculated for each metric. So here we have for neck pain, we've got a goal for pain intensity, pain frequency. We also have a goal for outcome questionnaires. The goals are based on the 30% improvement over a 4-week period of time. Then we can click on the frequency, so 3 times a week, let's say, and then reevaluation. Let's say we want to do a reeval in 2 weeks consisting of maybe the verbal numeric rating scale and the outcome questionnaires. If instead we were doing a reevaluation in 30 days, we could click on 30 days or 4 weeks, whatever you want to do, and then check off which items we're going to be doing. Long-term goals are grayed out for now. Most payers really want to see the short-term goals between now and the next re-exam. We will be adding that at an update, and we'll be adding that so that the long-term goals would go to normal. Work restrictions, usually a workers' comp thing. Here are a few things that you can document. Some of the things open up another menu that you can do, like lifting, repetitive lifting, things like that. Nice and easy. Croft guidelines, I'll show you a video for personal injury coming up so you can see how that looks. There you have it. If you have any questions, feel free and email me at Dr. Greg with 2 G's at the end of Greg at thebulletproofchiro.com.